I don't remove your original kidneys. They stay where they are.
They shrink up, if I'm not mistaken.
Yeah, exactly. They're still, doing some stuff now, but over time, they will just kind of what's called atrophy. They will kind of shrink a little bit. So the new kidney goes lower down, kind of towards the pelvis. We free up the blood vessels that run towards your leg. Once my dissection of that space and those blood vessels is complete, and my partner's dissection of the donor kidney is complete, we will remove the kidney, immediately flush it with a cold fluid, clean it up a little bit, carry it next door, and sew it in place. I'll connect the vein of the kidney to your vein, the artery of the kidney to your artery. I will then restore the blood flow to the kidney. Once everything looks okay, either myself or my urology colleague will connect the kidney up to your bladder and then close the incision. After the surgery, you'll go to the recovery room and then you go upstairs to the transplant floor. I need to tell you the risks of the surgery. There's 2 risks to any surgery, and that's bleeding and infection. There's always a chance for bleeding, possible need for a blood transfusion, and that's really very unlikely in either case, donor or recipient. The other risk is infection in a surgical incision, infection around the kidney where the kidney's been implanted, or infection in the urinary tract. A donor's chance for infection is very, very small. Your chance for infection is a little bit higher. Why? Because you're going to be on the immunosuppressive medicines. So those medicines, while they help prevent rejection of the kidney, they kind of prevent the immune system from doing its other jobs as well, so it makes you more likely to get infection. So we have to watch you carefully for that. Last thing you need to know is, as often as we do this procedure and as good as the results are, in a very small percentage of cases, the transplant might not work. So you might need a second operation to either fix something with the kidney or even possibly remove the kidney if it has clotted or failed. From a technical standpoint, that happens very, very infrequently, about 1 to 2% of the time. So 98 or 99 times out of 100, take the kidney out, put the kidney in, and it works just fine. And there's every reason to believe that's what's going to occur today. Bottom line is, we'll take good care of your brother today, we'll take good care of you today, get your new kidney today.
Thank you.
All right, let me just look at that catheter that you have there. Okay, good. And that's been in just for about 2 weeks.
Yes.
Okay. When you wake up, you will have, that catheter will still be in, and we'll use that while you're here in the hospital to draw your blood and to give you certain medicines. So that's actually a good thing. It spares you having to get that intravenous line today. So that's a good thing. And when you wake up, you'll have a catheter in your bladder that will drain the urine, and that will stay in for about 3 days. You'll also have a little drain that'll be coming kind of out of your side, and we put that around the kidney. It kind of clears fluid from around the kidney for a few days, so we don't want any fluid building up around the kidney and pressing on it and possibly getting infected. So that drain we leave in place, that clears some fluid from around the kidney. And we usually remove that either before you go home or you might go home with it and we take it out in the clinic a few days later. So that'll be the 2 main tubes that you'll have once you wake up.
Gotcha.
All right?
And then roughly the recovery is 3 months, if I'm not mistaken?
Probably a little bit less. I mean, you're a young, otherwise pretty healthy guy, so you should.
No, you cannot go to the gym.
No, you're not going to the gym anytime
That's
soon.
what he's looking. That's what he's trying to
You're
look
right
at.
about that. So
You're not going to the gym.
Yeah.
Like the gym, like I'm saying, like September, roughly, maybe?
I would think so. 3 months, yes. Less than that, no. In terms of you, feeling well and being up and about and driving and doing things like that, that's going to be quicker. And then our case managers and coordinators will talk to you about some infection precautions, right? Because you're going to be on the immunosuppressive medicines. You start off on a high dose, and then that gradually gets tapered down to kind of a baseline or a maintenance dose. But when you're on that higher dose, you have to take certain precautions. So you don't have to be what I refer to as kind of bubble boy. You don't need to be boy in a bubble, but you don't want to be, around sniffling kids.
Right.
Or,
if you're gonna go out anywhere, any friends coming around, you wear
right.
a mask. They should wear whatever.
Yeah, if they're not.
I'm just thinking.
Exactly.
Yeah.
The thing that I worry about most is people have an office job that's got 500 cubicles and everybody's breathing the same recycled air and that kind of thing. So, but we'll deal with all those things. We'll our case managers and coordinators will talk to you about your specific.
So what type of activities would you recommend me do for the summer? I know I was planning on walking in the park. I know not right away, but let's say in a month or so. Like I know that you guys want me to walk as soon as possible.
Walking is good. You're going to be walking tomorrow.
Yeah,
You'll be walking upstairs tomorrow.
Okay.
All right, so we'll talk about all that stuff as things go forward. For today, the goal is for us. Obviously, we're going to give you 100% of our best effort. We're going to take good care of you today. We're going to take good care of your brother today. We're going to get your new kidney today.
Thank you.
And then we'll take it from there. All right, I'll see you across the hall in just a little bit. All right,
Thank you.
I will come out and talk with you as soon as we're done.
Okay.